The American Society of Plastic Surgeons, which happens to represent some 11,000 members, and they make up more than 90% of the field in the U.S. and Canada. Well, they broke ranks with most medical associations when they backed away from endorsing interventions or gender mutilations for children and adolescents who have gender dysphoria. So this is a major development, because one of the primary reasons that both lawmakers and courts have given time and again for supporting so-called gender-affirming care is that they say all the U.S. major medical associations support these harmful procedures. So as the evidence continues to pile up against all these procedures, as well as the lawsuits from those who have suffered at the hands of so many of these doctors, could this, right now, could this be the first of many dominoes that are about to fall? Well, joining me now to discuss this and more is pediatric endocrinologist Dr. Quentin Van Meter. He's the immediate past president and now executive committee member of the American College of Pediatricians. Dr. Van Meter, welcome back to Washington Watch. An honor to have you.
I'm glad to see you again. Thanks so much, Jerry.
Okay, so let's talk about this. The American College of Pediatricians has long opposed these procedures, but the manufactured consensus, and I say that deliberately, the manufactured consensus among almost all the medical associations has been used by activists to support all these harmful procedures. So what is the significance, in your opinion, of this now bold position from the American Society of Plastic Surgeons?
I think the move says that the organization membership is beginning to realize that they might be being run amok by a small group of activists in their midst. And so the way that the professional societies work is that physicians belong, and many of these organizations require a board certification in that specialty. And so being a fellow, so-called, in these organizations is an honor. It sort of shows that you have academic precedent behind you, you're well-trained, you're certified in your field, and you're looking for like-minded colleagues to join together and look at the broad range of issues that your specialty needs to work on or improve, or to, for the patient advocacy or for the advocacy of the physicians in the organization themselves. So it's all about improvement. It's all about keeping up with science. It's all about, providing educational guidelines, overseeing the medical curriculum or helping develop medical curriculum for medical schools, graduate certification programs, et cetera. So the professional societies have a really strong purpose and have had this purpose pretty much from their inception. What's happened is that the politics have invaded, and slowly but surely the administrators for these groups, not necessarily even physicians in the specialty, but people who are essentially administrative staff, take over and organize the organization so that members, physicians, can practice their medical practice and not have to worry about admin duties. And these administrators tend to be a little bit on the political liberal side. And then as politics move in and money flows in and contributions flow in, the core administrators tend to take over and introduce ideas as policy from these organizations. And that's what's happened with the Endocrine Society, with the American Academy of Pediatrics, with the Plastic Surgery Society, and all of the groups that kind of came forth with a rubber stamp of, these are the guidelines, this is what we're told, this is the science behind this, let's go ahead and endorse this. And that's what happened. When the membership begins to be a little more agitated about what's being said, because the science is not in support of these transgender affirmation tactics, then they start to get inside and say, we're questioning this. And the plastics surgeons got to, amongst themselves decided, no, we've looked at the science. It's blatantly not there to support removing healthy organs and trying to transform a body to the appearance of the opposite sex from the biologic sex. And so they just stood up and said, there's no science. We're not going to endorse this anymore. And our hope that these will begin to waken up members of other professional societies, such as the American Academy of Pediatrics, and say their membership now wants to call into question with their administrators, where did this policy come from? It's not based on fact. It's based on hopes and whims, and it's experimental to do these things to children. And so that is what our hope is, that other organizations will wake up. We are in a coalition with some 30,000 physicians worldwide with the Declaration for Protecting Children, which is the doctorsprotectingchildren.org. It's a good, wonderful place to go and see the declaration that calls into question the science behind social, medical, and surgical interventions to facilitate the appearance of a child to pretend to be the opposite sex.
Well, I think you hit it on the head with so much of what you just said. But bottom line, when you said this all went wrong when government got involved, it's a political, when it became a political issue, that's when lives started being destroyed. That's where all the science went out the door. And I mean, we've all heard the old adage, if someone knocks on your door and says, I'm from the government and I'm here to help you, that's when it's time to run. And the same is true when we're dealing with medical associations. When politics enters the equation, it seems like everything always goes downhill. And as we have in this case, the ASPS has acknowledged that there's all sorts of uncertainty to the long-term efficacy for chest and genital surgical intervention. They talked about the evidence base is viewed as low certainty. Now, that has a specific meaning. Can you explain that to us? What does the low certainty mean from a medical perspective?
Well, it says that there is no scientific proven evidence that what they're recommending actually is beneficial. And medicine needs to progress with evidence that is positive, that looks at potential harm versus benefit and balances that fairly. And does not fall into an ideology instead of science. And so the low basis for certainty should essentially put a screeching halt to recommendations for interventions such as surgical manipulation or excision of healthy organs to try to have the patient appear to be the opposite sex in order to satisfy their emotional uproar, which is going on internally. So the low certainty is really important. It's not politics. This issue has nothing to do with, if you're on one side of politics or the other, you'll be for or against these interventions. This takes politics out of the picture and says, let's just go back down to the basics and say, if you put mayonnaise on your nose, is that going to cure cancer? And the likelihood is the evidence is very low that that's a benefit. And therefore, we should not recommend as an organization that you put mayonnaise on your nose to cure all of the cancer that might be in your body. So it's not whether or not you're leaning left or leaning right. It's like, wait a minute, let's just look at the science and let's say, above all things, you don't want to do harm.
Yeah, absolutely. I mean, that's a great illustration. And I think that's something that everyone puts a smile on their face, but they say, yeah, I get it. I get it. And the low certainty is back to science, where all of this ought to be from the very beginning. Now, when I look at this, and of course, in all fairness, everybody knows this, but I'm no surgeon, I'm no doctor, so this is your league, not mine. But when I look at all of this, plastic surgeons, they're in many ways on the front line of all of this, right? I mean, when you have these radical surgeries, obviously it requires a plastic surgeon to come in and repair all the damage that's been made and try to make that boy now look like a girl or that girl now look like a boy or whatever the case may be. Plastic surgeons, they're kind of on the front line of all of this and they're required. So how could that reality, that they are kind of the tip of the spear in many regards of all of this, how do you think that reality may have affected their position, that they just realize we're headed for all kind of lawsuits, all kind of problems, the reality, low certainty, we're on the front line of these surgeries, we better get real with all of this. Was that part of their thought processes, you think?
Well, I think they are physicians at heart, okay? So their whole purpose is to do no harm, and their purpose is not to gloss over things with something that's touted to be a cure, but which they really know is not a cure. So plastic surgeons are in the unique position of having to be very well versed in mental health, because they can't really just sort of punt and say, okay, we're going to send you to a mental health professional, and whatever they say, we're going to believe. All we are as technicians, we're just the guys in the garage who fix your car. No, they are actually looking at the whole human being, and the ethical nature of the plastic surgeons who do so well and are caring so well for their patients is that they clearly state to the patient up front, what are your expectations? Because we're not going to be able to do something that's impossible. If it's in your mind and you're never going to be satisfied, if it doesn't really hit the nail on the head, we do not want to be responsible for having done something to you in an effort to cure your sense of your poor appearance. I mean, there are realities. And so we are going to be very ethical at what we do, and we're going to refuse to do things that we really feel are not ethical and not based on science.
Great perspective there. How does all this track, if you will, with the developments that we've seen over the last year or so in Europe, where they have been backtracking on all of this, and now maybe this is yet the beginning of a momentum for backtracking here in the U.S. But how does all this track with the developments in Europe?
Well, again, they were, Europe tends to be progressive politically. So what they did, I believe, is to say, let's keep politics out of this. Our systems in many of the countries are essentially socialized medicine. So government is the provider. Government is the arbiter of what can and cannot be done, or should not be done. And they began to look at the real outcomes, because they have been in the business of working with gender dysphoric patients, both children and adults, for about 10 years more than the United States has been. So they started looking actually at 10-year and 20-year outcomes, because that's important. You really want to do something. If you're going to provide a treatment, you want to be sure that 20 years out, you've got survivors. You've got people who are positive, that have borne the benefit of the interventions and are much better off in the long run. And they found that wasn't the case. That when you waited past 10 years and got out toward 20, more and more people were falling down with the problems that they had that were there from the beginning that had never been adequately addressed. So they said, we are putting on the brakes, because the claims are being made by the folks that want to do this, that there is clear, unequivocal benefit and you are saving lives. And when we look at the data, we find that is absolutely not the case. Therefore, we're not going to let it go on. If we're going to end up doing anything, it's going to be on a tightly based, scientifically pure protocol that in 30 or 40 years may have the answer. But there's nothing that we want to do in the meantime that could possibly harm children.
Wow. Well, this is a fascinating conversation, Doctor. I really appreciate this. And I do hope this is going to represent first of many dominoes yet to come. What do you hope to see as time moves forward in this?
Well, I hope to see that the organizations that have been so stalwart here in the United States will actually open a dialogue, and at their annual conferences will open the room to discussion from one end to the other in front of everybody, so that the membership doesn't feel like things are being done behind their backs or at a higher level, and they don't understand the science, and they are beginning not to believe in that the science is there to promote this. So my hope is that all of these professional societies will re-examine where they stand. The Doctors Protecting Children Declaration actually asked the organizations to do just that. Please open your minds, open your doors, allow dialogue to happen, and let's get this straightened out as soon as humanly possible, so that we can save the lives of these kids the right way.
And quit looking at one medical association to the other for answers and start going back to the science.
Yes.
But thank you so much, Dr. Quentin Van Meter.
Happy to be.
Quentin Van Meter, it's an honor to have you from the American College of Pediatricians. Incredible conversation. Thank you for breaking all of this down for us. We appreciate it.
Very welcome. Take care.